As we enter spring, many states are reporting an uptick in COVID cases. Here to discuss this is our medical expert, cardiologist, Dr. Payal Kohli. Dr. Kohli, thanks for joining me. Should we be worried about the BA.2 subvariant? I know we've seen these cases really increase dramatically over the last couple of weeks. So is that a big concern right now?
2 years into the pandemic, we're certainly better prepared than we were before. We've got vaccinations that are highly effective. We've got antiviral therapies. We've got more testing protocols. But I really do think it's time to start paying attention to this uptick in cases, because in January, about 50% of the country was infected with Omicron. So, for 3 to 6 months after, we're still in the honeymoon period and relatively protected. But now, as we head into the summer, we're just getting to that end of that 3 to 6 months, and we may start seeing more and more infections from BA.2, especially because we know that it's even more contagious than the Omicron variant, which really took the country by storm in January.
And switching gears just a little bit, because you're a cardiologist, I would love to have you address one specific concern. We've heard about cases of heart inflammation in teenagers after getting the COVID-19 vaccine. In fact, it was a big concern for my father, who sent my younger brother off to college this year. So how common are these cases? And as people consider getting their next vaccine, should that be a concern they should take into consideration?
As a cardiologist, I had thought that I would see tons of cases of myocarditis or inflammation of the heart muscle occurring after COVID vaccine, but I have to say I have yet to see a single case. Now, that's not to say it doesn't happen. It does happen, but it is quite rare. So the estimated incidence is about 2 out of every 100,000 people. And if you look at the demographic that's most likely to get it, it's usually young or adolescent or young men up to about the age of 29. Now, despite all of this, and despite the theoretical risk of heart inflammation occurring after these vaccines, the American Heart Association, myself, and most of my colleagues that are cardiologists very strongly endorse the vaccine because the benefits far outweigh the risks. Even if you get a case of myocarditis or inflammation, for most people it's mild, it's transient, and it's self-limited. And the infection itself, keep in mind, can also cause myocarditis actually at a higher rate than the vaccine. So we're really encouraging people to sort of not even think about that risk. If you're someone who's not had myocarditis before, has not had an adverse reaction to a vaccine, just go ahead and get that vaccine or that booster if you're eligible.
And lastly, let's take a look back for a moment. We know thousands of schools across the country were closed at the height of the pandemic. In hindsight, was it worth it to close schools? Did it do more harm than good?
Yeah, this is a really tough one, actually. So we've looked really at modeling data to try to understand the impact of school closures. And what we've seen, according to the models, is that the school closures did have a positive impact on reducing the spread of the infection. But here's the problem. A million other things happened at the same time. So there are other effects that could have confounded the results, basically, including closures in other parts, including parents working from home, including the fact that we weren't traveling, all of the other things that could have affected that. So it's really hard to know in isolation what the impact of school closures would have been. It's also hard to know at this point. We all know that mental health has gotten worse after the pandemic, including in our children. But is that a direct result of school closures or a direct result of many of the other things that happened during the pandemic? So I would say, looking back, honestly, it was the best weapon that we had against this virus at the time, when we didn't have vaccines, we didn't have many of the other therapies that we have now. But today, the good news is, knowing what we know, having the variants that we have, it is unlikely that we're going to end up in a situation again where we have to take such a dramatic step.
Dr. Kohli, once again, thanks for your insight and your time.
Thank you.